Hi, I'm Dr. Annie Savage. I'm a naturopathic doctor. Today we are going to talk about progesterone. So by the end of this video, you should understand what progesterone is doing in your body and the signs of when you have too much progesterone or too little. We're also going to go into how we can balance your progesterone and your estrogen levels. Please like this video, subscribe to our channel, and click the bell for notifications so you know when a new video comes out every week. Progesterone's main action in the body is maturation and a decrease in proliferation. If you remember from my last video, estrogen's main job in the body is to increase growth and proliferation. So we have a differentiation between estrogen and progesterone in that way. Think of estrogen as essentially growth and a lot of it, whereas progesterone is giving us some fine tuning to that growth. It's making it more mature. In the uterus, in the luteal phase, progesterone is decreasing that proliferation that our estrogen has caused so that the endometrial lining actually changes into a secretory organ, and this allows for implantation to occur. This is how we are able to get pregnant. So symptoms of low progesterone within your cycle would be clots in your period blood. This isn't something that's talked about a lot, but your period blood shouldn't actually have clots in it. When we see clots, we know that something is going on with your hormones. So large clots, think of maybe a loonie or a toonie size, we know that your progesterone is too low. It's normal to see some shedding or strips in your period blood, but not actual chunks of blood or clots. Your period blood should also be a nice crimson red, with the beginning and the end being slightly darker or older blood. But the majority of your period should be nice, bright, healthy red blood. Progesterone also has a nice calming effect on our nervous system. So this occurs in men and women, and it actually increases our ability to achieve deep sleep. So we need our progesterone to sleep. This is something that we commonly see in perimenopause and menopause age women, that their hormones are declining, which is normal, and we expect that to happen. But what starts to happen is their anxiety starts to go up and they have really difficult interrupted sleep. So they can fall asleep, but then they wake up throughout the night. This can also happen in our childbearing years when our hormones are out of balance. Estrogen is very activating, whereas progesterone is nice and calming. So when we have progesterone that's too low, you feel anxious, overstimulated, or overactive. Progesterone also increases our body's core temperature. This can start to shed some light for women who experience hot flashes or hot flushes within their cycle, or when they get to that perimenopause or menopause age. Some women will experience hot flashes or a type of hot flash with their period where their hormones are unbalanced, so they do get that flash of heat that might interrupt their day or their sleep. And then we know it's much more common in our perimenopause, menopause age women, but it's still showing us a hormonal imbalance. So we can actually address it by balancing our hormones. Tell me in the comments below if you think you are suffering from low progesterone. So we know that we need to have estrogen and progesterone in a nice balance to have a normal cycle and to feel normal and healthy as women. If you're experiencing that low progesterone picture, you'll be feeling more anxious with interrupted sleep and clots in your period blood. We know that we can balance this out, and we want to build your progesterone in the second half of the cycle when it's meant to be higher. So during that luteal phase is when your progesterone is going to be higher naturally. So that's when we want to elevate it as well. If you're interested, click the link below for seed cycling, which is an easy way to introduce some hormone balancing into your life. You can use seeds or foods, which is very easy to implement in your diet. Just follow along those instructions and you will be building your progesterone back up.